It's Friday, October 2nd, and this is now on HNN.
Breaking news. After announcing he tested positive for COVID-19 overnight, President Trump is being taken to Walter Reed Hospital for further medical evaluation.
They remain in good spirits. The president does have mild symptoms.
Coming up in our special team coverage, we'll talk to multiple medical experts about the president's risk.
How to deal with the president today and what happens over the next couple days.
My heart goes out to anybody who catches COVID.
These stories, plus we'll break down the timeline of Trump's recent movements, coming up on This Is Now.
Good afternoon. Thank you for watching. This is now on this Aloha Friday. I'm Jonathan. Alongside Ashley here, we'll have the very latest on the breaking news regarding President Trump in just a moment. But first, a check of the local coronavirus numbers.
State health officials say 3 more patients with COVID-19 have died, bringing Hawaii's official death toll to 142. DOH is also reporting 87 new cases today. The breakdown shows 70 cases are on Oahu, 16 are on the Big Island, and 1 is probably a resident who was diagnosed out of state. Now to our breaking news. This is a live shot from the White House where you can see Marine One there on the lawn, waiting to take President Trump to Walter Reed National Military Medical Center in Bethesda, Maryland. White House officials say he's being moved to the medical center out of an abundance of caution, and he may remain there for several days. The president and First Lady Melania both tested positive for the coronavirus overnight. Their 14-year-old son, Barron, has tested negative. Earlier today, the White House doctor said the president was fatigued and had been injected with a special combination of drugs, including an experimental antibody cocktail. Deborah Alfarone is at the White House with more on the president's diagnosis and its impact on the campaign trail.
This was an earth-shattering development, and it certainly throws a wrench into the rest of campaign 2020 for the Trump administration.
White House officials say President Trump and First Lady Melania Trump are in good spirits despite displaying mild symptoms hours after testing positive for COVID-19.
He is hard at work. We're having to slow him down a little bit.
I'm optimistic that he'll have a very quick and speedy recovery.
The diagnosis came after one of the president's closest aides, Hope Hicks, tested positive for the virus Wednesday. That's when she began exhibiting symptoms. The chief of staff confirmed the White House had been notified of Hicks' status before the president left for a fundraiser at his New Jersey golf club Thursday.
White House operations made the assessment it was safe for the president in consultation with others.
Notably, the president kept his distance from reporters during that trip.
The president's diagnosis has sidelined him from the campaign trail with only about a month left until Election Day. Meanwhile, the White House says contact tracing efforts are underway for anyone who's come in close contact with White House staff.
Vice President Mike Pence's office announced he has tested negative. President Trump's daughter Ivanka and son-in-law Jared Kushner say they've also tested negative.
As this virus continues to go on, other people in the White House will certainly have a positive test result, and we've got the mitigation plan in place.
2020 Democratic presidential nominee Joe Biden is campaigning in Michigan after he and his wife Jill announced negative test results Friday. The Bidens were tested due to their proximity to the first family at Tuesday's debate. In a statement, they sent well wishes to the president and First Lady.
White House Press Secretary Kayleigh McEnany said that we may hear or see from the president soon. I'm Deborah Alfarone reporting in Washington. Back to you.
Joining us now is Dr. David Agus, CBS News medical expert. Doctor, what can you tell us about how the president is being treated right now?
So the president was exposed obviously to COVID-19 and he tested positive, which means there's detectable virus in his body. And then we're told that he's symptomatic, mildly symptomatic at this point. So there is no FDA-approved regimen for someone who is mildly symptomatic like he is. And so when you're more symptomatic, remdesivir, an antiviral, is appropriate. Or when there's significant lung issues, steroids or dexamethasone are appropriate. In the last 2 weeks, there were data on monoclonal antibodies that look really encouraging in early virus infection. And certainly the president could be part of a clinical trial and get those medicines. And I know his doctors are certainly thinking about that. But the White House has their own doctors, and they're consulting with others about how to deal with the president today and what happens over the next couple days. Everybody who starts with mild symptoms has different courses. Some can get much worse and end up in an ICU, and others can get better very quickly. And the problem with this virus is we have a hard time predicting what's going to happen.
Seeing that we have what looks like a new White House cluster, how far could this reach? How far could the spread grow?
The problem with this virus, which makes it distinct from every other virus we know, is that asymptomatic people can spread the virus. And if you're going to become symptomatic a day or two prior, you can be contagious. That's different than other viruses. You know, with the flu, when you're sick, you know to stay home and you're contagious then. You're not contagious before. And so the problem is now we have to go back and say, who did the president communicate with several days before he tested positive? And the same with Hope Hicks and everybody who's testing positive, because those people need to be quarantined and tested. And that's our contact tracing program that is integral so that the virus doesn't spread massively.
Dr. David Agus, thanks for joining us. Ashley, back to you.
The last several weeks have been busy for the president. He's been holding campaign events, choosing a Supreme Court nominee, and he participated in his first debate with Joe Biden. CNN has created this photo timeline of the president's movements over the past 2 weeks. Let's take a look. Yesterday, on October 1st, he was last seen in public returning to the White House after a fundraising trip in New Jersey. He did not speak to reporters as he walked into his residence. On Wednesday, September 30th, he traveled to Minnesota for an outdoor rally in Duluth and a private fundraiser in Minneapolis. The day before, he was in Cleveland for his first ever debate with Joe Biden. The challengers did not shake hands, and at one point during the debate, he mocked Biden for wearing a mask on the campaign trail. On Monday, September 28th, he held an unexpected event on the south lawn of the White House where he met with workers from Lordstown Motors, a small automotive startup. And last Saturday, he introduced Amy Coney Barrett as his nominee to replace the late Ruth Bader Ginsburg on the Supreme Court. Later that night, he held a rally in Middleton, Pennsylvania.
We also have insight about the Trump's positive test from Lieutenant Governor Josh Green, who tested positive himself and just wrapped up quarantine a few days ago.
Well, you know, my heart goes out to anybody who catches COVID. So to the president and the first lady, what the president is probably worried about right now is that it is a question of mortality. When you do catch COVID, especially if you're a little bit older, you have higher risk. He's, of course, worried about his own life and his family's. I'm sure he's very focused also on the First Lady, because you feel a sense of responsibility and even guilt when you have the virus spreading amongst yourselves and your family. I remember when I was first diagnosed, I immediately worried that I might have given it to Jamie. So that's probably what he's focused on right now. Both Vice President Biden and President Trump are at extremely high risk for not just catching COVID because of their proximity, but for very serious consequences. The mortality rate for white males over age 70 with COVID is one heck of a lot higher than it is for people in their 30s or 40s. So they have to take it very seriously.
Hawaii's unemployment office has been adding more staff to answer calls and process claims, but many say they're still frustrated trying to communicate with the state labor department. Casey Lund has an update on the latest efforts to solve the problem.
And I want to say this right off the top. The unemployment numbers have gotten better. They are working through PUA claims a lot more quickly. And I've talked to a lot of people that say they're getting those claims paid out, and they're very grateful for that, even though it's taken so long. But I want to remind you that a couple of weeks ago, we asked the DLIR about that new call center. They said by the end of September, they'd have 100 trained staffers to answer people's calls and help those claimants through their issues. It launched on Wednesday at noon, and within 36 hours of it being operational, we talked to some of the folks that tried to call in on those new numbers. This is what they had to say.
I saw on the group post this morning when I woke up that they had a new call center up and running and that things should be going smoothly. And I was like, oh, okay, sure. Why not? Tried 40, 50 times. And this new system was even more infuriating than the last.
I will call 10 to 20 times a day and nothing. Can't even get through. It will just go They'll just say, please call again later or try again another time.
It was very hopeful to a lot of people when the governor announced this. And now it's not. Everybody's very upset, feeling like, this is just a complete waste of time. And then to discover that the person that you spend your entire day trying to get a hold of can't actually resolve the issue so you can start getting paid.
Now, I talked to a lot of people yesterday. Some of them didn't want to go on camera, but they told me that they were able to get through. And they also mentioned, though, that when they did get through to somebody on the other line, it was just someone that told them an examiner would be able to call them back. Now, I also spoke to DLIR Director Ann Pereira Estacio, and she tells me the call center went online officially again Wednesday at noon with just those 50 agents working, not the 100 that we expected by October 1st, but she says that more help will be on the way very shortly.
By Monday, we should have about 120 agents online. And by mid-October, we'll have our 200 online. So as soon as we get those 200 all working all at one time, we're probably still going to continue to see heavy workload.
There is some important criteria that claimants have to meet in order to apply for that 13-week lifeline of extra payments, and it's important that they get going on that application as soon as possible. We have all the information online at our website, hawaiinewsnow.com. Just look for this story. Reporting downtown, I'm Casey Lund for This Is Now.
So many people have been waiting for this and hoping for an economic boost. The pre-travel testing program to allow visitors back into the state starts in 2 weeks. But will it be safe? Ben Gutierrez has more.
Lieutenant Governor Josh Green is trying to reassure residents that the pre-travel testing will be enough to safely reopen the state to tourism. But others say that will also open the door to more people who are infected and don't know it.
A lot of people are suffering on the neighbor islands where the economy is almost completely tourism-based, and they see that we have a hope to open up, but they have a fear, will we bring disease?
That's the balancing act the state is performing by allowing travelers from the mainland to skip quarantine if they test negative within 72 hours before arriving.
Get that test, you do it 72 hours before your departure, your keiki that are under 5 don't need it, you're negative, you come and have vacation.
Lieutenant Governor Josh Green says that 1 out of every 1,000 travelers who is negative in the pretest will still turn out positive. With 8,000 daily arrivals, that could mean 8 new positive cases every day just from visitors. Other doctors say that number could be even higher.
The most sensitive test we have cannot pick up anything in the first 3 days. By the 4th day, when the virus starts to explode in your body, the test could pick up maybe 33%, so it's missing 67%.
Lee Evslin is a doctor on Kauai, which has the fewest active cases.
Worried with somebody, now people wandering into our stores and our restaurants, and I know a percentage of them are going to be spreaders. Makes me nervous.
Visitors will still be susceptible to the same laws regulating gatherings, social distancing, and masks.
You still take precautions on the plane. Everybody needs to take precautions when they get here. Okay, just because they're tourists doesn't mean they can go and run around and have parties and do all this stuff.
If there are glitches, we'll readjust. But I don't want people to be afraid.
Green says he's already hearing that there's a demand from visitors who want to come to Hawaii. He estimates that with the pre-testing plan, visitor numbers could reach 50% of their record levels as soon as February of next year. Ben Gutierrez, Hawaii News Now.
Maui County Mayor Mike Victorino wants travelers to take a second test after arriving on the Valley Isle. This as the state prepares to launch its pre-travel testing program on October 15th. Here's what the mayor had to say this morning on Sunrise.
First of all, the number of kits that you have available is going to be very important. My second testing that I'm really pushing for is trans-Pacific, not so much inter-island. Inter-island, I would like to see them get it before they come, and that way I would be comfortable with letting our neighbors from the other islands arrive here and hopefully be safe. And again, let me clear one thing up. There is no 100% fail-safe system that will work. Even the lieutenant governor admits that. All of us, all my medical experts that I work with, all admit that there is no fail-safe area or methodology. However, with that being said, I've got to make sure our residents are protected and safe from outside travel. Now, we've been really good with our numbers. Even though we've had high numbers in the past, we've had it well under control, and I'm very proud of the people of Maui County, my administration, my team, and what they're doing. We've worked hard to make sure we stay safe and healthy here in Maui County, and we want to continue to do that. So the second test really falls on us, the county, and I have ordered a huge number of kits. Something like 30,000 kits are on their way in, and I would think that with the first trickling in, and I'm going to use the word trickling in, of guests starting October 16th, from the 15th on, I don't see major numbers and major tests being done. I will say this, I'm getting a little pushback from the resorts because they don't like the idea of 48 to 72 hours sitting there and not letting those guests traverse the island. But if you do your bubble like we've asked you to do and you take the safety precautions that we're asking you, you can let them utilize your facilities in the resort for the first couple of days, take their tests, and then we're looking at rapid tests so we can get results back within 24 hours, if not shorter. And then you're off and going and enjoying your stay here in Hawaii and Maui.
Yeah. Mayor, I know you said there could be a trickling, but at the same time, who knows how many visitors you get? Are hotels, are businesses in the area, are they prepared for an influx of visitors?
They're preparing themselves, but from what I've been reported, a lot of hotels are getting reservations, but not by large numbers. I've been checking with the industry themselves, and there's not large numbers. Many of them say it's really a phased-in opening. They're going to only open up certain segments, certain towers, certain portions of their hotel initially, and then see how their bookings continue to grow. I really am a strong believer that it will take time for people to be convinced to travel for leisure and to travel safely. And so when you're putting yourself in harm's way, they're not going to travel. And if we're not safe in Hawaii, and especially Maui County and Maui itself, people won't want to come. They'd rather go somewhere else or not take a vacation at all.
Yeah. Real quick, Mayor, you mentioned it, inter-island travel. When would you like to see inter-island travel opened up?
I would like to see it open up almost simultaneously with Trans-Pacific. I think we've had the inter-island quarantine for quite some time now. Our numbers, Kauai's numbers, have been fairly low. Big Island has had some surges, but most of them are related to care homes, and we know all about that here in Maui County. And so, and Oahu has dropped tremendously from what they were a month ago to where they are now. So I think we're making good inroads. I believe all of us need to continue being vigilant. You know what you said, physical distancing and wearing a mask and good hygiene, all of that. That's the responsibility. That's our part, as citizens, to do that throughout the state. If we are doing that, I think the numbers will diminish even further, and we can start to reopen very safely and with very little chance of major spread again.
I want to take you now live to the White House. This is Marine One on the White House lawn there. President Trump about to be transported to Walter Reed Hospital. You can see the propellers there firing up right now. We're going to continue to monitor the shot, and we will let you know as soon as that transport starts to begin. We do not know if he is in Marine One yet because we're sort of blocked from our vantage point here, but we will continue to monitor and let you know as soon as it happens. In the meantime, let's turn it over to Guy Hoggy.
How's it on this Friday? We are tracking a disturbance that's moving through the state. We're seeing some spotty thunderstorms pop up from now and then, every now and then, and it's affecting mainly the east end of the state. But keep in mind, this disturbance is moving from east to west. As of right now, we've got most of the rain over the east side of the Big Island, but notice there are some showers developing for the central part of the state. And slowly, as the disturbance moves to the west, Kauai will get in on that action as well. Although for the better part of this morning, Kauai will remain mostly dry. And those winds, well, we've got light and variable winds, soft and scrambled. Again, that will lead to higher than normal humidity levels. It's going to be a sticky day today. And temperatures running to about 90 degrees for some spots, but of course it's going to feel warmer than that because of the high humidity levels. Sunset a little earlier, the days are getting shorter. It's at 6:17. Now we're also tracking a rising swell for North Shore. Some of the rep will get down to the west side. This is borderline high surf advisory level waves, so it's going to be a dangerous situation, especially for those unfamiliar with large surf. Now we've got more swells on the way for both east sides and town sides. In fact, the town swell could get quite big. We're talking Sunday into Monday, maybe beyond advisory level, so keep an eye on that. So again, spotty spotty thunderstorms today through tonight. Drier conditions, fewer showers, still a little damp from time to time for some areas on Saturday, and then stronger trade winds with even drier conditions due back on Sunday. Keep it here on Hawaii News Now. We'll have all your severe weather updates.
All right, here's that live picture yet again from the White House. Marine One, it is off the ground to transport President Trump to Walter Reed Hospital. Ashley, you were mentioning earlier, he announced on Twitter earlier today that he was diagnosed with COVID-19 along with First Lady Melania. Correct.
That's right, and he's being taken to Walter Reed National Military Medical Center in Bethesda, Maryland. White House officials say it's out of an abundance of caution and that he may be there for several days. Their 14-year-old son, Barron, was tested negative. The White House doctors said he was feeling fatigued today and had been injected with a combination of drugs, including an experimental antibody cocktail.
And they are saying he's expected to spend a few days there. We also heard earlier from Deborah Alfarone, who said she was told by White House officials that we could see or hear from President Trump very soon. I don't know if she meant by this appearance here, by him leaving there to from the White House, or by some other sort of appearance. You know, he is very tech savvy. He's always on Twitter. Maybe we should expect another tweet from him. But in the meantime, we're going to continue to monitor this developing story. We're going to get to some other news, switching gears here quite a bit, and getting to our From the Feed segment. And up first, we're going to talk about a new Airbnb option, right, Ash?
Right, so it's Halloween season and Airbnb wants you to go to Hell, Michigan. It's a town, people, so calm down. You can book an Airbnb for this hell-on-earth tiny home in Hell, Michigan. The self-proclaimed mayor of the unincorporated town is offering the mayor's lair for 3 nights in October. He says you can be mayor for the day at a cost of roughly $31 in honor of October 31st. There's a fire pit, outdoor movie screen for scary movies, a Queen of the Damned bed, and a Gothic sitting area. The online rental company calls it, quote, the spookiest Airbnb stay on Earth.
All right, and some more Halloween news, right?
Krispy Kreme is getting in the Halloween spirit with its new crop of donuts. The chain released what they call Scary Sweet Monster Donuts. The treats are designed with 3 classic monsters in mind: Frankenstein, a werewolf, and a vampire, and the donuts go on sale Monday.
I love that Frankenstein one. That is adorable there. All right, let's get to some good news, because there's some transportation options coming to a different part of town. We're talking about Beaky. The bike share program is installed 3 new stations in Kaimuki. One is at Kaimuki Community Park, the other is on 12th Avenue. So I love this option for transportation. I use it all the time. Actually, I used it yesterday to go to the mall.
And Kaimuki is a great spot. There's so many good restaurants,
so
and
needed.
bars.
So needed there, for sure.
Absolutely. And this year's virtual Ironman competition starts October 5th. And to get psyched up for the race, the Facebook page will be showing a week of programs celebrating some of the greatest moments in the race's history. The winners from the virtual Ironman race will be announced at the end of the week. The athletes will have to log in online at various points in their 140.6 mile triathlon. Whew.
God, there's a virtual option there for sure.
I'm exhausted just saying 140.6 miles.
Right. All right, guys, we're going to take you to another live picture. This is outside Walter Reed Hospital there in Washington. We're still waiting for the president to arrive there. We're going to monitor this. We will bring you any updates. We're following this all day long here at H&N, so stay with us. Our digital team will send you an alert as soon as any developments happen. Stay safe, everyone.